questions, and you can answer ask them, is my question. I've got two questions. Since using the technology, have you found that you're using it more and more for things that you never even thought that you could? And what are the top 1 or 2 applications of the technology that you didn't even know that you could use it for, now that you're using it more?
So I might want to just give you guys a little bit of the background, just because I'm not sure exactly what you know. So Dr. Michelle and Andrea, here is where we came about using NeoGen. I was very hesitant to purchase another device because I've been doing this for 17 years. I have so many different laser-based devices in my practice that when I was seeing the before and after results that were given to me from the NeoGen company, I really honestly couldn't believe them because they looked way too good to be true. And after researching it and after really understanding the technology, it proved itself to be very, very accurate. The reasons I brought it into my practice were that I could use it on darker skin types very, very safely, all the way through type 6. And that was really important to me, having darker skin. So that was probably the number 1 reason. It was safe. The second reason that I brought it in was because I could treat the eyelids. I could treat the eyelids, which was a very unique property, because with my laser devices, I wasn't using corneal shields. So I really always had to be very careful about avoiding the eyelids, both the upper and the lower eyelid. So the fact that I could get basically what looked to me like almost surgical results with NeoGen on the eyelids was the second reason that we purchased it. And as I became more experienced with it, I realized that it could improve all qualities of skin. It didn't matter if someone had irregular pigmentation, acne scarring, acne breakouts, just general rejuvenation. And the amount of collagen rejuvenation and tightening that I saw, I've never seen anything like it. Yeah, that's a good question. The device is extremely consistent. So if I have a patient who at 4 weeks maybe thinks they aren't seeing a result, we simply take photos. That's it. We just show them their before and after photos. Even at 4 weeks, it's actually pretty consistent at 4 weeks. However, we recommend that the patients get a series of treatments, simply because with each treatment, they're going to see further results. If we've certainly had patients that only have one treatment, we may see them back at 1 month and then maybe 4 months, 6 months, 1 year, even a year and a half later, and their results have maintained themselves. I would say that our 1 month patient results are not as good as our 4 month patient results. There's just a continued improvement in collagen regeneration at 4, 5, 6 months. Our 6 month patient results are similar to our 1 year patient results on that patient, if you know what I mean. So we see the most change in that first 3 to 6 months, and it is sustained. So sometimes I've even seen a patient 2 years later who's had 1 treatment. They still look good, but I would like to see them have a series of treatments. We space them typically, if we do a low energy treatment, we space them about 6 to 12 weeks apart, depending on the patient and their ability to have downtime more than anything else. I think that's a very good question. In my experience, NeoGen it probably penetrates about 20 to 30 microns of the top layer of the epidermis. However, if they've had a recent laser or chemical peel, that they are going to have a little bit more deep penetration of the energy. So a 0.5 joule might actually act like a 0.8 joule if they have recently had a procedure. So you just have to keep that in mind. We've done several hundred patient treatments. I mean, probably thousands of patient treatments, honestly. I should add it up. But we had one patient who really just had a lot of exfoliation right before her treatment. And she was a skin type 4-5. And maybe we weren't as clear with what she had done on her own prior to the treatment. We did a 0.8 joule triple pass treatment on her, which should be fine. Actually, in all of our other patients, it's fine. But she had post-inflammatory hyperpigmentation that lasted several months. She recovered 100%, but that you don't want to deal with that. That's probably the only thing we've had. Otherwise, we do recommend that the patients are careful about what they've done. If it's simply using tretinoin topically or doing non-aggressive treatments, they can stay off their products for 1 week prior to the NeoGen treatment. If they've had a more exfoliative or aggressive laser, I recommend they wait about 4 to 6 weeks. And it's not going to harm them necessarily, because this plasma energy is very, very different from laser energy. It's not going to harm the skin in the way that lasers can harm the skin. It's non-ablative. So the non-ablative nature of it makes it a totally different category. That's probably one of the biggest differences between it and the plasma pen. So although they both use plasma energy, the nitrogen that's used in the NeoGen system is completely different, and it's a non-ablative treatment. So you can use it in all skin types. You can use it without worry that you're going to have scarring or other permanent hyper or hypopigmentation. I think that the combination approach is very appropriate. It's very appropriate to utilize NeoGen to do things that specifically other things just can't do. Obviously, it improves skin quality, but it really improves tightening of the skin, and it stimulates collagen in a very profound manner that's visible on your before and after photos. But of course, they're going to want to continue with their products to provide the nutrients to stimulate collagen, and then they, depending on what you're doing in your practice, you can put them on a regimen that makes sense for them and continue your other procedures in between. I think in our practice, we ended up selling several of our laser-based devices in the past little over 2 years, because we did get NeoGen, and I realized that I would never reuse those again based on the safety profile and the results. So, but I don't think you have to throw everything out. Patients do respond differently to different treatments. And so we now do combination treatments with NeoGen as well, which we really enjoy. So. You can expect to have excellent results with no pre-treatment protocol and with no post-treatment protocol. It's not that it won't help to have that, but we don't, we treat patients very often immediately if they would like that, if they're ready to have a little bit of social downtime. So it really comes down to that. But we do not rely on our pre-treatment protocol. We do not have them on hydroquinone for 6 weeks prior like I used to with my lasers. Again, this is non-ablative, so you can really be comfortable that you're not going to injure them or cause any kind of, delayed recovery. And you can expect that their results, in my experience, the results have actually been the same whether we put them on a pre-treatment protocol or not. Now, post-treatment protocol, we are still trying to figure out. The simpler, the better, because what I've found with NeoGen is that they are so, their skin is so permeable after the treatment, so that any product we use could potentially go right in and act more like not a topical, but a systemic result. So that can cause irritation of the skin. So we've gone away from treating patients with any products for about a week or two after the treatment. We are just using Cetaphil cleanser, a gentle cleanser that they can use, and then that's almost it. Maybe a little bit of Aquaphor because sometimes they're itchy and dry, but we tell them to minimize it. So the less we use after, and then at their 4-week visit is when we institute their products, because we were just having rare allergic type reactions that could occur at 1 to 2 weeks after the treatment. And we just decided we didn't want to mess up, you know, we didn't want to cloud the issue. We couldn't decide if it was from the device or from the products, and it was rare. So I think it was the products, but. I think you could use sunscreen safely about 24 hours after the NeoGen treatment. And that's what we recommend for our patients. 24 hours after the treatment, if they want to put their makeup on, I mean, I know that sounds like a little bit too much, but they can absolutely use makeup safely. I think the permeability at that point has gone down. So a lot of them will wait a week. We ask them to wait a week, but if they can't for social reasons and they want to put it on, we have not seen a problem with it, as long as they wait 24 hours. And sunscreen, I think, goes into that category.